Thanks for joining me. I would like to encourage you to like, share, and subscribe to my channel if you have not done so yet, because I intend to produce weekly content. I want to use this blog to address the need to take a proactive action to address the legacy of COVID-19. While there are many components to this legacy, I want to focus on the children who are orphaned or will become orphaned as a result of COVID-19. Before addressing this issue, I want to share a story with you that took place in the 1950s in Jamaica. I heard of two children who lost both parents, mother and father. The circumstances of their death will be revealed in my upcoming book. The children were aged 3 and 5. These children represented the second generation of Indians who were brought to Jamaica to work as indentured workers. The death of both parents meant that these children had limited support. During this time, other close relatives also passed away. I am sure you will realize that during this time also, there was limited social services, and as a matter of fact, social services was in its infancy. Over the years, the children were cared for by their aunt, who was just 10 years their senior. Her best was good enough because she supported my mother, yes, my mother, who was one of the orphans, to achieve her full potential within her capacity. Furthermore, her consistent mentoring of me helped me to believe in myself, and she was there every step of the way. I will not go further into my story. However, when COVID-19 became a reality, I pondered about my children. I pondered about who would care for them if both my wife and I passed away. My reflection will be a reality for many children in our country. Experts have suggested that COVID-19 deaths could reach 10 million to 40 million. This could of course lead to children being without a parent or both parents. The experts go on to suggest that children who are orphaned are in many cases placed in vulnerable situations, which leads to greater victimization and exploitation. And we already know that the black and brown population in the United States have been the most adversely affected, and within this population we'll have the highest number of children without parents. Many of these children who lost both parents because of COVID-19 could end up living with grandparents. And of course, many of these grandparents will not have the resources to support these children. This brings me to another point. Have our policymakers considered the support required, or will this be another political game or debate? It should not be so. I must say that if you believe that wearing a mask was a political one, let's wait for the debate for providing for each of these children within the context of COVID. These children will need the best support to ensure that they are provided with counseling services to reduce possible trauma. The reality is that every child is different, therefore an approach that brings together trained professionals will be required to support these children. Rather than seeing these children as numbers, these children must be seen as individuals and must be provided with individualized support. Every child should matter, and no child should be left behind because of COVID-19. According to Human Rights Watch, governments will need to prioritize continued education for all children and also increase their expenditure on investments as it relates to technology. The provision of healthcare and other essential services must be seen as mandatory. For me, the most salient point of this report will be the need to identify children who are orphaned by COVID and provide the required support. This network of support must also include extended family and foster care. We are yet to assess the full impact of COVID-19 on children. As the Wall Street Journal puts it, the corona pandemic has ravaged families, and it's difficult to figure out exactly how many children have lost a caregiver or have been orphaned. And the experts also say that the scale of losses is likely to be staggering. One social worker stated, "Children are asking who will take care of me, or will it happen to me, or will it happen to the next person who's taking care of me?" The Washington Post and other national news networks have highlighted the impact of COVID-19 on children who have lost their parents. We also have young people caring for their siblings. As I bring this blog to an end, I want you to reflect on your role in assisting these children. Do you have a role to play? And that's a question. Should the government allocate additional support for the years to come for these children? That's another question. And my final question is, do we need a national initiative to support these children? I believe that our society, policymakers, political leaders, and all stakeholders should begin advocating for these children. It is a time that we must get back to the thought that it takes a village to raise a child. That's my critical thought. Thanks for sharing, and that's all for now. Please remember to like and subscribe to my channel.